تعد أمراض الأنف والأذن والحنجرة أمراضاً شائعة بشكل واسع. في التقرير التالي نوضح أسباب انسداد الأنف المختلفة، كما نلقي الضوء على علامات وأعراض التهاب أنسجة الأذن والتهاب الجيوب الانفية الحاد وطرق العلاج الحديثة.
في لقاء مع الدكتور يحيى قابيل اختصاصي في جراحة الأنف والأذن والحنجرة في مستشفى الزهراء بدبي، أوضح لنا أكثر أسباب انسداد الأنف شيوعاً.
The most common causes of nasal obstruction we encounter in our clinics are allergy. Allergy is very common in UAE. It's estimated about 70% of people have nasal and sinus allergy. So it causes congestion of the mucous membrane lining the nose. That causes congestion means swelling of the lining of the nose, so it blocks the nose. Sometimes chronic allergy leads to formation of polyps, which are like fleshy swellings in the nose that can cause severe obstruction. This is really the commonest one we encounter, but you can also have common colds, flu, foreign body stuck in the nose, especially in children. Trauma, injuries, can also cause obstruction because of blood clots or fracture of the bones. But really the commonest by far is nasal allergy, which we call allergic rhinitis.
وتحدثنا مع الدكتور يحيى عن علامات وأعراض عدوى التهاب الأذن الوسطى وعدوى أنسجة الأذن.
Otitis media literally means inflammation of the middle ear. Okay, the otitis means inflammation of the ear. The suffix itis means inflammation, and oto in Latin means ear. So otitis means inflammation of the ear, and media is the middle ear. The commonest cause we encounter in our clinics of otitis media are either viral or bacterial infections, or sometimes get also fungal infection. Usually the inflammation starts in the upper respiratory tracts, like the nose, the throat, and then the infection, the bacteria or the virus can travel through a little tube that connects between the back of the nose and the middle ear, called Eustachian tube. It's a very important tube. It functions to equalize the pressure in the air. But it can be a channel also for the bacteria or the virus to travel through it and reach the middle ear and cause an infection there. This is the commonest cause. Other causes can come from outside. Maybe the infection can come from outside, perforate the drum, and then the infection goes into the inside of the ear.
وأشار دكتور يحيى إلى مرض التهاب الجيوب الأنفية الحاد، موضحا طرق العلاج الحديثة المستخدمة.
Sinusitis is the inflammation of the sinuses, or call them, the full name is paranasal sinuses, because they are all connected with the nose. We have sinuses in the forehead, sinuses in the cheeks, sinuses in between the eyes, and even the base of the brain. The collection of sinuses, 4 groups. And they can get inflamed individually or collectively. All of them can get inflamed, and we call it pansinusitis. Again, the commonest cause we encounter is allergy, but you can also have a viral infection or bacterial infection or fungal infection, which is a bit rare. I don't see it a lot. And the treatment is basically medical to start with. Give anti-inflammatories if it's inflammation, or antibiotic if it's a bacterial infection. Viruses are not touched by antibiotics, so we just give things to boost the immune system of the patient to fight, the viral infection. But the commonest, again, it's like rhinitis, is allergy. It's very common in this country. The treatment of sinusitis has evolved a lot in the last maybe 20 years or so. After 2 particular inventions, like CT scan, for example, and the endoscopic surgery. These are 2 very important changes that really evolved so much how we treat sinusitis, surgically in particular. But obviously, like just to differentiate between acute sinusitis and chronic sinusitis. Any acute disease means it's a quick and sudden, and usually the symptoms are severe. Chronic inflammations, again, generally, chronic means long term, so they persist for weeks and months, and we call them chronic. And the symptoms can be mild, are not very severe. But on top of the chronic, you can have acute exacerbations as well. So for chronic sinusitis in particular, it has been challenging, to treat in the past. But after the invention of CT scans, we're able really to visualize the interior of the sinuses very clearly and achieve very accurate diagnosis and know the anatomy of the patient so well. So when we do the operation, we are more aware of which areas to approach. The other change was the endoscopic surgery, which is minimally invasive. Instead of doing any cutting from outside, we just use fiber optic endoscopes. We can reach all the sinuses we couldn't reach before and do a more complete and safer surgery to the patient, and more successful consequently.